Hey there, it's Dr. Brian McKay from Core Health in Darien. Well, today we're going to talk about another exciting topic for some people. Some people it's not too exciting. But have you ever heard of plantar fasciitis? Plantar fasciitis is, people who run a lot, tennis players, people stand on their feet. Sometimes they used to call it a policeman's foot as well. But basically, the fascia is this thin tendinous band across the bottom of the foot. And what happens is this tension that creates irritation, which leads to what we call adhesions. And when you think about adhesions, just think about like micro scar tissue. If you keep you're standing on your feet and you have an imbalance in the arches in the foot, something could go wrong where all of a sudden it just starts to wear against each other and start to wear away. But also that it irritates because you have a lot of nerve endings in the bottom of your foot. So it's a pretty common thing, and typically people are going to do the most common thing I would say is ice and Advil, that type of a thing. But it's not going to really it'll stop some of the pain, and then typically your first line of defense is going to go to a podiatrist. And if the reason you're having the plantar fasciitis is in the foot, chances are you're not going to be seeing me to fix it. And let me tell you why, because podiatrists do a pretty darn good job as long as it's below the ankle. So what happened is a long time ago, I started studying a technique called Groston. And Groston uses another name for it is IASTM, Instrument Assisted Soft Tissue Mobilization. And what it does is you use like a stainless steel surgical instrument to break up the adhesions, and it's quite effective. A little kind of painful side, I got to be honest with you. So we started treating that, plantar fasciitis with that, but it, the idea here is you just can't localize to the foot. And that's the podiatrist typically won't go past the ankle because that becomes an orthopedic issue. And when you're having it, a lot of times people are going to take cortisone shots. Cortisone just shuts down all the inflammation and you go on your merry way. Some of the times. I mean, it does work, but how often? Again, if it works, you're not going to be seeing me anyhow. But what I want to talk about is there's three muscles that, when addressed, or if you don't respond to cortisone, Advil, Aleve, ice, and that type of stuff, or bracing, and if we address those three muscles, I'll go over each one of them with you. The first one you really want to address is called the tibialis posterior, and it's one of the most central of all leg muscles, and it's in the deep posterior, the posterior being the behind compartment of your lower leg. And it's a very important muscle because it stabilizes. It stabilizes the lower leg, and a lot of times this muscle is involved. And if you just say you get an orthotic, which is another way to treat this thing, to take some pressure off that area, you're still going to have the further up the food chain. So you got to get in there. And if you just put your hand on the outside, I'm sorry, the inside of your leg, and go down, that's where we're going to find the tibialis posterior, that large, pretty large muscle. It's not the calf. Sometimes the calf is involved, but not a whole heck of a lot. I mean, the gastroc and soleus as well. So what I typically do is I find adhesions in the tibialis posterior, and how we treat those, we'll go into that a little bit long. Now, another muscle is involved is called your flexor digitorum longus. And what that does is it kind of moves the big toe. Digitorum, meaning toe, longus, so it's a real long one. And it's on the tibial side of the leg, the posterior compartment. It's thin and pointed at the top where the origin is, but insertion increases in size as it tends to go down. And what this will do is it serves to curl up the second, third, and fourth and fifth toes, 2, 3, and 4. Okay, now the flexor hallicus longus is the one is similar. They run very similar pathways, and what they do is they go into that goes into the big toe. So you have tension in these three muscles again: posterior, the tibialis posterior, flexor hallicus longus, and flexor digitorum longus. You're really not going to get to the root problem with plantar fasciitis. And there are superior ways to treat it these days. Laser is one. It's great. It's you feel just a little bit of warmth on that area, which is again very 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 good. It's a phenomenal treatment. But when you combine it with radial pulse shockwave therapy, it's even more effective because the radial pulse shockwave will break up the adhesions, stimulate blood flow, and in doing so, you get more blood to the area, you open up the area, you break up the adhesions, you have better flow of the muscle, where the muscle is not as restricted, and you remove these adhesions and stimulates cellular regrowth. You jack that up with laser, cold laser, and that starts ramps up the healing process. So when you just look for these three muscles, and if you're stuck and you're not getting better with plantar fasciitis, if you like to run, you can't run, it's a very viable way for you to get relief. And the good thing is it's not a long-term thing. You're looking at several treatments, and it's I would say the first treatment you actually could feel better after the first treatment, but typically it takes 2-3 times before you start to see the improvement, and about maybe 7 or 8 treatments overall before you get resolution. So plantar fasciitis, well, it's not that common, but for runners, tennis players, golfers, people get it, and it's painful because you have a lot of nerves in the feet, from sensory nerves. Besides, you have motor nerves, sensory nerves as well. So it's one of those things. If you think if you think you have plantar fasciitis, chances are check with your podiatrist. Seriously, if they can knock it out, you don't need me. If it's a real tough case, chances are they're not looking at posterior tibialis, flexor digitorum longus, and the flexor hallicus longus. So if you have any questions, Dr. McKay, Core Health Darien, 203-656-3636. 203-656-3636. All right. Hope you're having a healthy, happy new year. Let's get COVID over with, and let's get you running again if you have plantar fasciitis. Thanks very much for listening.